we've got a number of people now, including Victoria's Chief Healthcare Officer, the former Australian Deputy Medical Officer Nick Coatsworth, a number of MPs, the Treasurer here in New South Wales just this morning, all saying it's time for Australia to start considering reopen international borders. How do you view the risk-reward profile here?
Well, I think it's time to start thinking about it. It's certainly not time to start opening borders because, we have a population that's been totally unexposed to COVID-19. So if they're not vaccinated, we'll just be the next India if we open our borders. But what we need right now is a transparent, evidence-based plan that's going to guide how we're going to open. And although there's been a lot of talk from various officials, nobody has given us a plan. And that's really what we need at this point.
In terms of India, repatriation flights for Australians stuck in India have now resumed, but all those people are going to be going to a remote quarantine facility in the Northern Territory. Is this what Australia needs as well? More of these sorts of quarantine facilities out of the major cities?
Well, I think that we are going to need a risk-based quarantine system. So again, we need kind of a plan to get us there. But when we're largely vaccinated and when many people in the world are vaccinated, there needs to be a more bespoke approach to quarantine than everyone who comes into Australia is quarantined in the same place for the same amount of time. So what I would anticipate happening is that you'll have a setup where people from countries at higher risk or coming in who are unvaccinated will go to what should be purpose-built quarantine facilities that have, a lot of great ventilation, that don't have shared air. And then people who are lower risk or have been vaccinated might quarantine for shorter periods of time in the more traditional hotel quarantine that we have now. So something that's more risk stratified so that the highest risk individuals who are most likely to be infectious and have a highest risk of actually having COVID are at certain facilities, and people who are much lower risk are at others, and perhaps for shorter periods of time. So that's what I'd anticipate. I think currently people are thinking that, the need for quarantine will just disappear, and I don't think that that's going to be anytime soon.
Dr. Baxter, here in the U.S. already, they've changed tack and now they have dropped the mask mandates. But a lot of people are concerned about that. It's been heavily criticized, especially because you don't know when people have been or have not been vaccinated. What do you think of this approach? Well,
I do think that is what's essentially problematic there is that, your anti-vaxxers, anti-maskers are not necessarily going to be honest with people about whether they've been vaccinated or not. So, you have this honor system that I think is going to break down in the United States. And the whole thing is that until you have a really high number, and by high, it's higher than they currently have, higher number of people that are entirely vaccinated, if you allow it to circulate by people not wearing masks, then it's still going to be out of control. It's still going to be too much for the health systems to be able to cope with. I understand why they're doing it. They're doing it both because people are really, really sick of the restrictions of the pandemic, but also as a way to encourage people to get vaccinated. Right now the demand is kind of underwhelming. They have too much supply and too little demand, and clearly still need to increase the proportion of the population that's vaccinated. So I think it's a way of trying to encourage people, but I have real concerns that it's going to lead to, maybe not a full-blown wave, but definitely an increase in cases.
Yeah, the U.S. is really running out of that pool of people that actually want to get vaccinated now that the shots are widely available. So how do you get there when it comes to vaccine hesitancy or anti-vaccinations? Is this about an issue of trust? Is this an issue of public health education? How do you get there?
Well, they've been doing a lot of interesting things. So there's in Ohio, they're having a lottery for $1 million every week for people who've been vaccinated. In, I think it's New Jersey, they're offering free beer. So there are a lot of different things that are being used to motivate people to come out. But essentially, I think you have to understand why people aren't going for vaccination. And there's no one reason. So I don't think that there's one simple silver bullet that will get people out to be vaccinated. So I think now it starts to be looking at specific demographics and how you can get them out. I think your point about trust is a really important one, because a lot of times people are vaccine hesitant versus anti-vax. Like some people you'll never reach, but there are some people that are vaccine hesitant. And I think working through those people, their healthcare practitioners, so their family doctor, is a really important way to overcome distrust, to have someone who they have a relationship with talk to them about vaccination. Unfortunately, that takes time. And, in a pandemic, time is one of your most precious resources. It's very hard to wait because waiting for people to get vaccinated means you're going to have more cases and more people die of COVID. I think there's also the political element where you have Republicans who don't want to get vaccinated. It seems kind of ridiculous to say, but it is true. And so I think that there needs to be some type of political change and political discussion about getting Republicans vaccinated. I think that will make a difference.
In terms of vaccines, we're hearing the news that some vaccinations in India are now being cancelled because of a cyclone approaching the state of Gujarat. What's your assessment of the situation in India right now? When do you anticipate that things are going to start to flatten out there?
Well, the whole thing about India is right now vaccines are not going to change the tide. Vaccines are something that changes the tide in 2 to 4 weeks, 4 weeks really. They need critical measures, non-pharmacologic measures to change things right now, and that's lockdown. And even so, that takes a couple of weeks to start to have the decline. And remember, it takes 2 to 3 weeks for people to get really sick from COVID. So I think you're really looking at a month before we really see improvements in the hospitalization, the ability to really care for the people that have COVID in India. It's just it's a horrific situation. Eventually vaccination will help them get out of it, but in the short term, vaccination is not the way out of a peak in your epidemic. It really is the lockdowns, the masking, the non-pharmacologic measures that make a difference.
And yet vaccines are so important long term as well, right? And whether it's India or other poorer nations, really that access has not been there. We have heard about these temporary waivers of intellectual property for these vaccine manufacturers. Is that the way to get equitable access to these vaccines globally? Well,
I think there are a lot of different schools of thought about how critical the IP is to vaccine distribution. I honestly think the problem is largely a lack of will and a desire for countries, even that aren't in crisis, like, for instance, Australia, to have a very robust supply of vaccines, many more than we actually need for our population. And I don't have the solution, but certainly I say frequently that, we all have to have a global perspective, because if the pandemic is out of control anywhere, none of us are safe. You see in India, you have the new Indian variant. It's considerably more infectious than the Kent variant from the UK. You see what's happening now is that the Indian variant is taking over in the UK just as they're about to open. Most people under 50 are not vaccinated. So if they open as they were planning based on, the last variant that they had being under control, they're going to have a third wave. And it's going to be a third wave that kills a lot of people between the ages of 40 and 50. So, I think unless we really have some control globally, we're always going to be having these variants. We're always going to be having to, get the next vaccine or go into the next lockdown, because we just are, the pandemic's going to continue to rage out of control. So I think India is a good example of that, where, they've been producing a vaccine to be distributed elsewhere. But what we really need to focus on is getting the people of India vaccinated now, and that needs to be a global priority.
Well, the containment of the pandemic here in Australia was relatively successful, but I do want to get your views on the vaccine rollout here, which has been very slow, and particularly some of the messaging around the safety of the AstraZeneca vaccine. Do you think that was handled well?
Well, I think the one thing is that the government was in a challenging situation. So, the Australian supply of vaccine is primarily based on AstraZeneca. They kind of had bet on a number of different vaccines, but the one that has they have supply of that seems to be effective is AstraZeneca. So, they have a large supply of that. Unfortunately, as we know, slightly less effective, although I think that that's not as important as the complications. So you have the vaccine-induced thrombocytopenia that is a serious concern. It's a rare side effect, but it's a serious side effect if it occurs. Originally they were thinking it was less than 1 in 100,000. Now it seems that it's more common than that. So obviously it's a low risk. If you were in India and the pandemic were out of control, it would make sense to take that low risk of these clotting problems to, decrease your risk of getting and dying of COVID. In Australia, it's a bit of a different scenario. We have zero risk of COVID right now. So accepting any risk of a vaccine side effect, people are doing the maths, and they're not seeing it come out in the favor of AstraZeneca. So you have these mass vaccination clinics that are giving AstraZeneca, and it's been hard to get people to attend. So there's not long lineups waiting for AstraZeneca. And I think if they were giving out Pfizer to people over 50, the lines would be much longer. And that's part of why they ended up accessing more Moderna. You talked about the shipments of Moderna that are going to be coming to Australia, so that's new. So they did not have a contract with Moderna before. So they've now negotiated it. So before the end of the year, there'll be 10 million doses of Moderna coming to Australia. I have a feeling that they're going to open up vaccination to all age groups for mRNA vaccines at the end of the year. And then they're going to have a plan in place to vaccinate everyone very, very quickly.